Transient ischemic attack is the technical term for a transient blockage of the blood supply to the brain. We usually use the term TIA because it's easier for people to remember. Many patients describe this as a mini stroke. It's important though to understand that this is not a minor problem and really should be regarded as an emergency that needs to be dealt with very, very quickly, because patients are at very high risk of going on to having a completed stroke, which can lead to devastating disability.
The first symptom was the feeling of going to faint, and this very hot feeling that kind of whooshed over, very quickly followed by the numbness down the left-hand side, which you really truly, I could have drawn an absolute line down the middle. Everything on the left, legs, arms, head, toes, everything went completely numb. That passed, probably lasted about 10 minutes, and you just sit there and think, what was that? It's very odd. And I didn't associate it with anything. I didn't immediately associate stroke symptoms, I must admit, so did nothing about it.
Symptoms of a transient ischemic attack, or TIA, usually last less than an hour. For most patients, it will only be 10 to 15 minutes.
Well, the second one was the next morning, and it was much more minor, more mild. And I thought about it during the day, and I thought, no, that's the second sort of episode of that. I think I ought to make an appointment with the doctors. But again, thought I'll do that next week. It was bank holiday weekend. It's never a good time with the doctor, is it? So I thought, no, I'll leave it. It's not urgent. I'll leave it. A&E. The third one was the same again, at my desk, almost the same time of day, 4:30 in the afternoon, almost identical. The same feeling, the same symptoms, the same numbness, the same feeling of going to faint, hot, prickly. And I thought, no, I really have got to do something about this time. I really must.
There are several different symptoms, but it's quite useful to use an acronym called FAST to help patients to remember the symptoms of a transient ischemic attack, a TIA, or a stroke. The F stands for facial weakness. So the patients may have drooping from the corner of their mouth, they may dribble from the corner of the mouth. A stands for arm weakness, so we ask patients to hold their arms up, and if one of the arms can't be held up, then they've got weakness. S stands for speech disturbance, so they may have slurred speech or they may have unintelligible speech. And T stands for time to call for help, because this is a medical emergency, it needs to be dealt with straight away.
Well, in A&E, I saw a triage nurse who again took down all my symptoms, and actually saying them out loud made me realise kind of what had happened to me. So my diagnosis was almost being confirmed in my own head as I went along, but the hospital did also confirm it.
Patients are most likely to be affected if they're above the age of around 55, and then the incidence becomes much more common in the elderly. But in fact, TIAs can occur in much younger patients, and so everybody needs to be aware of the symptoms of a TIA.
I'm very shocked because there's no family history. I don't have high blood pressure. In fact, my blood pressure at that point was usually quite low. I didn't have a particular cholesterol problem. I know I carry a bit too much weight, but nothing that anybody seemed to worry about. Fairly fit. I was completely shocked by it, really, the fact that it could happen to me, which is perhaps why I denied it in my own mind to start with.
There are a lot of other symptoms that can mimic a TIA. And so the first stage is to be sure that it is truly a TIA. And then the second stage is an assessment of what's caused the TIA. For example, is it primarily a problem related to the heart rhythm, or is it due to abnormalities within the blood, or is it due to abnormalities of the blood vessels? The majority of patients, a combination of treatment for their blood pressure, for their cholesterol, and drugs to thin the blood will significantly reduce the risk of them having a stroke.
The basic three things, really, I would say. One, it can happen to anybody at any time. Secondly, be aware of the symptoms, and hopefully the television campaign and poster campaigns help that. And thirdly, get help, and get quick help, because I took myself to A&E, which meant I had to sit there for 4 hours and have another one in the waiting room while I was waiting. If I perhaps had called 999 and got an ambulance, maybe I would have been slightly more fast-tracked and dealt with differently.
The reason why we think it's important that patients with a TIA seek help immediately is that within the next 1 week they have an 11% chance, so roughly 1 in 10 chance of having a completed stroke. And if we can intervene in that first week, we can reduce quite considerably the risk of them having a stroke. If it's beyond a week, they still have an increased risk, so that by a month, between 15 and 20% of patients will have had a completed stroke.